right. So anyway, as we promised earlier on, we're actually going to be talking about orthosis and prosthesis. Did I say that right?
That's right.
We have an expert in the house.
Who's going to help us out with the topic. We've got Mr. Edmund Lee. Thank you very much for joining us.
Thank you. Yeah.
And well, we've got a couple of props in the studio already.
I've got one on my lap right here.
She's got one here, and you've got a couple there. Tell us about the difference between prosthesis and orthosis.
Well, basically, this is what we call orthosis. Is a medical terms. In the words, is appliances or braces that you fit to the patient's body, and what we call prosthesis in terms of to replace artificial.
It's an artificial limb.
Yes.
So orthosis is pretty much a support device.
And correction and giving some support to the patient's body.
And it applies to all ages?
Yes.
So, well, how do you differentiate? I mean, how would you decide,
when the person needs it?
All right, okay, it's normally through the orthopedic consultant will decide it, and then the orthotist will go in as a professional to do the full assessment. Yeah, from that we decide which part suitable orthotics for the patients.
Is it necessarily expensive?
No. Well, it could be expensive, but our center is trying to make it affordable for everyone. And the most important thing as well, the orthotist, the process of making a braces from the assessment and the fitting stage is quite complicated.
And you mentioned it's custom made and designed for every individual. Before we get into more detail on the orthosis itself, let's talk a little bit about how many people really require these braces, basically, from the general public. Based on your experience, how many percent?
Well, I'll say it depends on condition. I'll say about 70%.
70%? That's quite a large percentage.
Yeah.
Everybody has an orthopedic condition they don't know about.
Yes.
Wow, okay. And I was actually looking at the pink and purple shoes right there.
Very cute.
That applies to younger
It's younger
children,
for younger children with much more for our cerebral palsy or Down syndrome children. We had that physical impairment, they couldn't walk properly, so we need to get a special type of shoe with an orthotic insole on it, so that in order for them to really get them moving to walk.
Okay, in terms of getting those kind of support devices and all that, where do we normally go to find that? Do we have to wait long if we're buying it for our family members?
No, normally it's, after seeing a doctor with a referral from the concierge, the process for getting one depends on what type of braces. Like this one is ready stock, so just through the assessment, get the fitting, it takes about 1 day. And for a custom-made Boston brace for scoliosis patient, it takes about like 2 weeks to order and custom-make it.
So it's relatively quite fast.
And can you just share with us more about this device?
Stories.
Yeah, well, what is it for?
Yeah.
It's basically for scoliosis, between after the age of 12 to about 14, mostly happen to girls, and they have S-curve.
What causes it?
There's a lot of, there's two types of condition, basically idiopathic and neuropathic. Neuropathics mostly happen for cerebral palsy children, and idiopathic is unknown. Cause is unknown.
And we're taking a look at what an S-curve looks like, and that is the more severe version of it.
Yes.
Perhaps women out there may have scoliosis, but they may not know about it.
Yes.
Oh, okay.
So how can they check?
Well, basically, we do a scoliosis screening in our center. Basically, with a simple test, they can come to. They're welcome to come to our center, do a free screening.
And when they have to wear this kind of support, how long do they wear it? Or how many hours do they wear it? How many years do they have to?
Normally, it depends. The orthopedic consultant would decide when they would wear it. It's normally after the 25 degrees, the S-curve. From that, then we could prescribe them a Boston brace. How long they're going to wear it? It depends on the consultant as well. It's starting from 18 hours to about 23 hours.
And how much does it normally cost?
Looking about 2,000 to about 3,000.
But it's a lifetime wear, or
it's not lifetime wear. It's normally basically a few years.
Basically a few years.
Yeah.
All right, we've talked about scoliosis, but what are the other types of illnesses and conditions that can be corrected with braces?
We flat foot. A lot of people doesn't really know they have flat foot.
Okay.
probably in old days, people know this like flat foot is common. Yeah, but nowadays, a lot of people have knee pain and back pain. It's due to the foot.
Oh.
Yeah, doesn't realize it. So with an orthotic insole, so it's, to prevent.
That's quite simple, I think.
Yeah.
That correction, I think a lot of people wouldn't mind.
Yes.
Yeah, and looking at that, you know, white shoe over there, it looks just like any other sneakers that I've seen. So what's the difference with that?
Right, okay. A lot of people doesn't realize it's like for children, you need proper footwear. So in our proper shoes, we get a heel stiffening. Yeah, and you shouldn't, normally a shoe could really bend it. Yeah, and it's not proper support shoe.
Okay, I'm going to
Try now. Go home, take out your
shoe.
running shoes and try it out. Yeah, but well, how would you know whether you're wearing the right shoe or not? Because once it looks good, you feel good. You're not really particular about as long as
women just walk out the store with the shoe they buy.
They still walk even if it's painful.
Yes. It's common. It's like for ladies, they will just wear whatever comes in terms of fashion.
Yeah.
Yes.
Oh yeah.
They're slaves of fashion.
In probably in our healthcare profession, we normally suggest you to get your feet measured by qualified people or probably shoe fitter, or probably see us to get your feet measured and prescribe the right orthotic insole in the shoe.
Yeah, but there's no reason, ladies, to stop wearing those high heels. We love them.
Yeah, sure. Your wife is watching on it. Okay, yeah, but now it reminds me of something else, because you already know what the condition is. You found the right device or the right gadget or the right support. But what about maintenance? Is it difficult to maintain?
In terms of maintenance, you don't really need to maintain it. But in our center, MyORTHO, we encourage people to come back every 4 months for a review checkup. It's just to make sure the braces is still doing well. And the more important thing is make sure the patient is still wearing it. Yeah. Some people delayed it for a few years, and we just realized it's still pretty new, the brace, and it shows that they doesn't wear it.
Right.
And having put on something like that, somehow I'm sure it affects the mind as well. So in terms of emotional support, how do you go about catering to that?
Well, basically we give them support in terms. It takes some time to get used to it, and normally, especially the disposable brace, a lot of children in first few weeks they can accept it. After later stage, they take some time with them with our support and the parent support as well.
There's a lot of psychological factors that are involved in wearing one of these, I suppose.
Yes.
Edmund, you've also got the first innovative check and fit foot examination for orthotic insoles in Malaysia. What is this machine all about?
Right, okay. It's basically it's a foot pressure sensing device. It's to check people's feet and the posture as well. And the most important check and fit, a lot of people just go to a normal shoe store to get their shoe. What we try to encourage parents to get their children or themselves assess their feet first before getting a right shoe. Yeah.
So what kind of results do you normally get? Well, what if me and Terry just
we
go
walk
there
in, one of us is gonna have a problem.
Let's have a feet check,
Definitely. In terms of, definitely. Probably perfect feet are rare in this world. Even the footballers, David Beckham, everyone has a foot problem.
That's why he can curve the ball that way.
Yep.
That's why he can curve the ball.
So anyone can just go in and check?
Yes.
Is it a free checkup or?
It's basically we offer free assessment later stage. If we're trying to explain the condition, then from that.
Well, when it comes to wearing proper footwear and proper insoles and all that, is it a lifetime thing or is it a correction that we're looking at?
Well, it depends. It's like for children, what we call the children's stage is correction stage. Once we achieve that, probably you don't need that. If it's elderly or probably senior citizen, you're looking at support stage. Yeah.
So what are the challenges that the senior citizens face when it comes to wearing all these things?
The compliances, and because the young, they are not taught to wear all this, and once they achieve their stage, they have to wear all this. Then there's the compliances as well.
Right. Now, are these items okay for travel? I mean, like when you get through a airport checkup.
Well, it's all right. It's like, I think probably with the knee brace, they'll check on it. Certain countries, they'll ask you to remove it. But in the European countries, it's quite acceptable.
It's quite acceptable.
Yeah.
All right, so that's one issue that probably we need to iron out when you purchase one of these. But before that, do you have any final words of advice for Malaysians watching out there?
Right, okay.
In terms of orthosis?
I think in terms is to seek a qualified people to get the proper orthosis to fit, and in terms to seek doctor's advice as well and get the right orthosis fitted.
Oh, where's your office again?
It's in Cheras, Taman Mida.
Okay.
All right, there you go. So if you want to get yourself checked and fitted, please do contact Mr. Edmund. How can they get in touch with you, sir?
Or basically just contact us and go through our www.myortho.com.my to make an appointment.
All right.
So it would be a better condition, you know. I guess there are more options for us to choose from, and especially for those, you know, having to wear these kind of support devices and all that. So.
Yes. For the ladies, it should be no problem because you're wearing support devices all the time.
Yeah.